Good morning. How are you today? Yes, you're here for your cranial nerve exam? Okay. No. It's really not a big deal. And what seems to be the problem? Okay. Okay. Oh, I'm listening. Okay. All right. I have to be completely honest with you as my patient. I know we just met, by the way. My name's Dr. Andrew Michaels. And don't worry, I'm here to help you. I'm going to help you. What we have here is the complete cranial nerve exam paperwork. But from what little you're telling me right now, I wouldn't suggest a cranial nerve exam for the condition you just described. Well, we can go through it. Yeah. The first part of the cranial nerve exam is, of course, an olfactory test. And what we do there is we have these small containers, vessels, with a smell in them. Can you smell that? Just use one nostril at a time, yeah. Okay, cinnamon, yeah. Okay. And then plugging that side of your nose. I'll just put this up to your nose. Do you smell that? Okay. What's that smell like? Yeah, chlorine or bleach. That's right. And you wouldn't want to, that's right, you wouldn't want to take that internally. Okay, we have one more. Okay, plug in this side. Okay, what do you think of that? All right, that's right. Roses, flowers, that's right. Let's do one more on this side. Just gotta get it in there. Gotta get it in there. Okay. All right, ready? Okay. Yeah, plug the nostril. Do you know what it is? Vinegar, correct. Okay, you did very well. All right, so what I would take from that is that your sense of smell is fine. I have these little tiny swabs that I have for exams. Okay. And we're going to dip them in this fluid of these bottles. And we're going a little out of order, but I want to try your sense of taste first. So I'm going to touch your tongue. What do you... Okay. All right. That's right, sweet. And I'll get another swab. Okay, and we're going to touch your tongue. Right like that. Just like that. And what would you say that tasted like? Salty, that's right. Okay, and one more. So we just swab it around in the liquid. And are you ready? Okay, one more time on your tongue. Very good. Very good. Just like that. Okay, what's that taste like? Okay, yeah. That'd be like a barbecued smoky flavor. Barbecue. Very good. And what we're trying to do there is just establish that your sense of smell is okay. So, hold still a minute. I just want to try something here. Checking your glands around your neck. Checking your... Can you do this for me real quick? I have a little trouble doing it. I think I need to tell you a small secret. I've actually had damage to my cranial nerve on the this side of my face. Watch, I'll show you a little trick. So I can blink both eyes. I can blink one at a time. And I can only kind of soil, see? But it's almost all healed, and if I don't draw a lot of attention to it and I kind of keep my eyes blinking together, I look relatively normal. What it is your cranial nerve is like a bunch of fingers. Okay? It comes up through your neck, around your ear, and it kind of radiates out in kind of like this kind of a fashion, different, tangential nerves. And if there's damage, you can tell if a person has stroke on one side of their face because only one side is affected. And I'm not seeing that with you. The condition I had was called Bell's palsy, and Bell's palsy takes sometimes 3 months to a year or longer to clear up. I'm on the longer side, where it's been about 6 or 8 months, and I'm still suffering from it. But when we say suffering, I'm having a little bit of trouble with my auditory canal and the nerves around my ear, and I'm having a little bit of trouble right here. And on my lip, this top lip hasn't. See, I can smile normal. Not very much, but I used to be like, slumped really bad, and it's almost all normal now. So, yeah. Well, I'm not embarrassed to talk about it, and I'm not upset if people ask about it, because I'd rather they ask and then they know. And that's the thing. People, they worry that they're going to offend me, but I'd rather discuss it and be open with it because it helps people understand what the condition is and how it can be fixed. Oh, I screwed up. I touched my face with these gloves. But that's okay. I don't think you have the old COVID-19, do you? No. So we went a little out of order. And now we're going to try the optic nerves, which is a big favorite to a lot of people. Oh, we dropped that. And what we're going to do here is we're going to I want you to close this eye. See, like this, but there we go. Look in there. And then keep looking. Okay, very good. Okay. Yeah. Okay, hold still. Keep that one eye closed. Very good. All right. Yeah. I feel pretty confident there. Let's try one more time. Now, closing the other eye, this one now. Let's check this side. So, just like that. So I'm good at that. See how good I am at it? Okay. Very good. I see what you mean. You might have a... Yeah, don't worry. We're going to get to it. Okay. We're going to get to it. Okay, looking right at my nose. I think I'm going to use this pen here. Will work better. Looking at my nose. Right here. Focus on the pen. Tell me when it leaves. Okay? So look straight ahead. The pen. Keep looking at me. Okay. Okay, once more. Keep looking at me. Okay. Keep looking at me. Let's do that again. Okay. Alright. Same thing. Look at my nose. Keep your eyes on me. When's it go away? Alright. Very good. Very good. Okay. Now, we're going to do side to side. Now, what I need you to do is, once again, focus right here. Alright. Oop. Sorry. Didn't mean to bump you. Okay. Do you mind if we do that again? Okay. Focusing right here. Keep your eyes on me. There you go. Okay. Once more. Okay. Do you mind leaning in for a moment? I want to push down on your eyebrows or your eyelids. Push down. I'm going to push up. Okay. All right. Just like that. Very good. All right. Okay. All right. Very good. All right. I'm just going to take some here. I think we're doing really good there. I don't think cranial nerve exam is going to show much with the condition you have. And I can see why they sent you to me. I want to check something with your hearing, okay? All right, I'm going to shake something in your ear. Okay? Hear it? Now I want you to lean forward. Okay, lean forward. And I'm going to shake or not shake. When it shakes, you tell me. All right? Okay. Shaking. Okay. 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 All right, let's do the other side. Ready? So when I shake it, you let me know, okay? Okay. 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 All right, with these tweezers, the same thing. I'm going to, when you hear it, please let me know. Just raise a finger, all right? Okay. 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 Same thing on the other side. Okay. 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 Very good. All right, very good. Let me check something real quick here. I want you to follow the light with your eyes. Okay, starting here. Follow the light. Follow it. Follow it. Follow it. Okay, once more on this side. Follow the light. Follow it. Follow it. Okay, it's a little tricky right now. We're going to try something different. Looking straight here. Okay, I'm going to look in your eye. Follow the light. I screwed up. That was me. I made a mistake. I want you to follow the pen with your eyes. Follow the pen. Okay? I'm just looking with the light. Okay. Follow the pen. That's right. Just like that. And once more, follow the pen. Okay, up this time. Follow the pen. Okay, follow the pen. All right. Check. Okay, same thing on this side. Follow the pen. Okay, thank you very much for that. Follow the pen. Okay, Same thing. One more. One more. Follow the bend. All right. Follow the bend. Okay. All right. We're going to check your reflexes real quick. Can you just give me your arm? This will only take a minute. All right. Hold on. All right. All right. Checking your reflexes. Let me check your wrist here. Once more. Okay. And then on the left side, if I can have your arm. Can you do something for me? Can you raise both eyebrows? Yeah. Okay. See, I still have trouble raising mine. And frown. You know, like a frown. There you go. All right, close both eyes tightly so that you cannot open them. I did that earlier, but I want to do it in series here. Okay, now the other one. Okay, close your eyes. Okay. All right. Now, show both sets of teeth. Smile. Smile big. Stick out your tongue. Okay. All right, now puff both cheeks out. Puff them. Can you make... Okay. All right. Can you lean forward again for me? I want to check something here. Around your neck. All right, sit back. All right, let me have your leg and put them up on the examination table. We're gonna check your nerve reflexes. Okay. All right, let me take the weight of your leg on my arm. Okay. All right, thank you very much. One more. Now your other leg, if you can turn a little bit. Okay. Ready? Just let me take the weight. Okay. Try that once more. Okay. All right. With this swab, that I used similar swabs before. It's not sharp at all. Won't hurt you. I'm going to touch you on certain points on your face. Please let me know if you can feel it. Just tell me okay or not. Okay? Okay. 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 Okay, very good. Very good. Thank you so much for that. Okay. Well, a lot of stuff you do is rudimentary practice, but this one's going to be a little strange. I need you to shrug your shoulders a little bit. Shrug them. Okay. All right. And turn your head from side to side. All right. I think we're just about done. Okay. Cranial nerve exam is not normally very revealing with the condition that you came in with. I understand that you have a lot of problems meeting the opposite sex, but in this case, cranial nerve exam is not very revealing of any physical reasons why you may not be attractive or be successful with the opposite sex. you've been going to a lot of message boards. Okay. For incels. Okay, so you think of yourself as an incel. Well, okay. I'm identified as a doctor because I went and got a doctorate at college. Your being an incel is because you have a hard time with the opposite sex, but also because you go to message boards. That's the criteria to identify as one, right? Okay. You see kind of the difference there. There's a wide difference. Okay, let's talk about this a little bit. Okay, so no, I'm serious. That's why I'm here. I'm here to help you. You know, I'm here to help you. So, let's see. That probably isn't helping. I've found that if you are not in a social circle, it's really hard to meet somebody of the opposite sex, or in other cases the same sex. Like, okay, let's back up because we're going to go all over here. Okay, let's just say you're attracted to a certain type of person, okay? And that's totally up to you, not anybody else's business. All right, the first thing you would want to iron out is, okay, I'm attracted to this group. I'm attracted to this type of person. And yeah. And how do I go about meeting and socializing with people of this type that I'm attracted to, so that I could, make connections, see? And the easiest way to do it is, always remember in the back of your mind, human beings are social, tribal animals. When you're ostracized from the tribe, it breaks the coding in your brain, and you're very isolated and lonely, and you start to, as a social animal, you start to develop neuroses and stigmas and other characteristics that prevent you from re-entering the tribal environment. And this is why, if you look at the primates, they work together as groups. Dogs are similar with packs. Once a dog is removed from the pack, the protection and the nurturing of the pack, it doesn't bode well for them. They don't usually survive for very long outside the tribe. So this is why it's important to not isolate yourself. I know you're replacing social interaction by going to these message boards, and you feel a connection. You feel like, a kismet with some of the people on the message boards, because they're saying some of the same things you want to hear and some of the same things you're thinking. But the reason you're thinking these things is because, now listen, because you're isolated, and because you're lonely, and because you're developing these pathways in your mind to compensate for not having other voices in your mind. And these voices are from the tribe, social interaction. And not everybody in your social circle would be a prospective mate. You could be in a social circle where no one in that specific group is a good match for you. But this is where the social group comes into play. When they accept you as part of the social group, they accept you as a friend, as a family, as one of them, Yeah. So you become part of the group. And in doing so, they will introduce you to, hey, I have a niece, or I have a nephew, or I have my cousin's kid. Reminds me of you. They're like you. I think you have a lot in common. And they've made a judgment on you because you've interacted with them in a social way. Okay? So social groups are very important to prevent you from feeling lonely. Yeah. Let's think about this now. If you're alone in your room and there's nobody there, would you say you are A, alone, or B, lonely because you're talking to other people? Okay, good. See, yeah, you feel lonely, but you are actually still alone. And being alone and being lonely at the same time, both. You think you're just lonely, but you're actually alone. The voices that are coming to you are not. Here's the thing. In a real life social interaction, primates read the face, the mannerisms, the actions of those in the group around them. They interpret, this one likes me, this one doesn't like me. These are skills. And these are skills you have to interact properly in social gatherings, social situations. Okay? Like weddings, funerals, right? Okay. Even going to the grocery store, being polite, oh, please, ma'am, you go first. You have just a few items. Please go first. People see that around you, and in that social interaction, that allows you to interact and show people, and your mind, the eyes, the ears, the pheromones you pick up from each other, all of this interaction is real and visceral, and you pick up these little tiny signals and cues. You know what a cue is? C-U-E, cues. You pick up these little cues from people around you. And that's how you interact with those around you. To make yourself a more acceptable, socialized primate, for lack of a better term, we are still primates. We are still great apes in a lot of ways. Now, we may have higher reasoning. We may have higher intelligence. We may have the ability to talk and better cognitive skills, but we're still a social animal. And what you've done with this situation is you've broken the chain, and you're not interacting as much as you could. And this is very important. What did I say before? When the dog gets ostracized from the pack, when the chimp or the ape gets ostracized from the social circle, they have to relearn, re-enter the social group. What you've done is you've isolated yourself, and you need to bring yourself back into a social setting. I would suggest, as funny as it sounds, there are a lot of groups out there that would be very accepting of you. And, for instance, if you had a drinking problem, I would suggest AA. Because AA is a wonderful social interactive group to help people deal with alcohol and drug abuse in a positive manner. Well, you don't have to believe what you say mumbo jumbo. You don't have to buy into the whole program. What I'm talking about with you in particular is the social interaction. So there are food kitchens, there are food distribution centers that need volunteers, and this would be an opportunity for you to do community work, community service, and interact with people, and really make a name for yourself in the community. And you might find out about other groups this way, Since you don't have a drinking or alcohol problem, AA probably wouldn't be the right place for you to enter into. But because you're a young adult, I would suggest maybe volunteer work at the hospital or at a nursing home. And they'd be more than willing to take you on and have you read to the patients and stuff. And this is an opportunity for you to really get out and meet people and talk and get a lot of wisdom imparted your way. And I think it's very important. I think I'm going to go this far. I've got my prescription pad here, and I'm going to write you a prescription. Yeah. You know about the St. Michael's down the way. I'm not Catholic, so this is not me trying to get you to go to church. But just from what I know about you, what in our interaction. Okay, I know St. Michael's has many programs. This is kind of like a silly prescription. It's not a real prescription, but here you go. Okay, take that. And the number on there is for the, they have a lot of outreach programs for young adults. And I'm sure they have at least 2, 3, maybe 4 programs with you in mind, somebody just like you. And what we want to do is we want you to start, if you look there, it says 1 group per week for the first 2 weeks. And then you're supposed to add a social interaction group, 1 group every week after that. So we want to get you up to 4 social groups by the end of the month. So you start out with 1 group for 2, well, it's actually 6 weeks. 1 group for 2 weeks, then 2, then 3, then 4. Okay? And if you don't like a group or you don't feel like you fit in or it's not working out for you, please stop attending or let the leader of the group understand why you're not comfortable in the group. That's very important. Yes. But do you kind of understand where we're going with this now? Okay. I could have sat here and made derogatory and negative statements towards you because of this condition and the way it's perceived and the way it's mocked and the way it's ridiculed. But I chose to interact with you in a positive way to let you know that we all go through this at different times in our lives where we feel isolated, where we feel like we don't fit in. And we just, we don't belong. And what we've done is we've ostracized ourselves. Maybe others have pushed us out, but we've allowed it. Instead of pushing back, we let them push us out. And now we're suffering the consequences of these actions. I think it's important that you have number one, you've recognized you have a problem. Number 2, you've sought out help. That's why you're here today. That's why you, that guy right there, that girl right there watching, that's why you're watching me right now. Okay? You've looked for help. And number 3, the third one, is we have some concrete answers. Not lip service and not bullshit. That's what it is. It's bullshit. But concrete answers on how we're going to get you from where you're at right now and elevate you back into part of the tribe, part of the social circle, part of the collective. Now, you can say this is all some kind of weird mind speak or, conformist bull crap, whatever you want to label it. I would like to label myself as a father, as a husband, as a doctor, as a hard worker, as a nice person. You're labeling yourself as an incel, alone, lonely, depressed, sad. But I can see it in your eyes. Looking at you right now, I can see it in your eyes. That's not you. Those are just labels. You have to be a human being first, and you have to be part of the tribe first. And you've got to feel like you belong. And if I go somewhere and I don't feel like I belong, I go somewhere where I do feel like I belong. And I want the same thing for you. That's right. I don't want you going around feeling isolated, lonely, sad, distraught. Those are labels I will not put on you. We need to get you back. Be part of the gang, part of the clique, part of the group. And it's not that big a deal. I want you to take this prescription I gave you. We're going to start at St. Michael's, maybe bowling. I know it's silly, but bowling leagues are a wonderful place to meet people. I love bowling. Can't you tell? And, you go bowling, you have a couple beers with the guys, the girls. Hey, you're an all right guy. I'm going to introduce you to my sister. It happens. It can happen. Well, I'll tell you what. You're never going to meet a girl doing what you're doing right now. Okay, we both agree on that, right? All right, fist pump. All right. So you're going to be brave. You're going to be a man about this. Or a girl, depending on. We're going to get you going in the right direction. Okay. All right. You don't leave anybody out here. So, okay. I know I'm the old generation. I don't know, how to say anything properly, but the point is, I'm trying to learn. And I've got to learn all these pronouns and new terms, incels, simps, furries, chads. I can learn all these new slang words and learn how to develop and build treatment for all of this complete anarchy. You have to turn around and you have to take those first steps in shedding that label and starting a new life. And today is your first day on the steps of recovery. Okay? And you're not going to find the answer in the bottom of a bottle. I'll tell you that right now. Nope. But I will suggest you get a vitamin drink, like I do. You get yourself a nice water-soluble vitamin drink that you can sip different times a day. And you keep it handy. And you take a couple sips. Make sure there's a little vitamin D in there. Vitamin D helps with depression. And the other thing that helps with depression is get your butt out there and get some more sunlight. Okay? I'm serious. Get out and see some sun. Let the wind blow in your face, blow some stink off. Okay? Does wonders for you. All right. Well, nice meeting you today. Okay. Well, okay. It was nice meeting you today. All right. Yeah. And I want to see you in 2 weeks' time for an update. And I mean it. 2 weeks from today, this Saturday, I'll make a special appointment. I'm going to see you and we're going to see where you're at. All right? And we're going to be done with all this incel business by then. Right? All right. I'm going to stay positive just for you. Finger guns are better than real guns, I think. Okay. All right. You take care and we'll see you soon. 2 weeks now. All right? 2 weeks. See you then. Until then, hey, you have a most blessed day. All right? Bye-bye. Yeah, we should have done this social distancing stuff sucks, but we'll get used to it. All right. Bye-bye.